There is another piece of work that's really important to us, and it's about the government relationships. We need to recognize that our relationship here, for example, with Health Canada, is with the agreement signed by the minister, goes far beyond the regional office. With Yusuf and all the work that he and his staff do here in the region, that's only one part of the picture. The federal bureaucracy in Ottawa provides a lot of direction to how things work in the regions. They develop new initiatives and they go after new federal monies to feed into programs and services that are rolled out through regional offices that eventually hit our communities either through agreements that are either transfer or the other kinds of arrangements that are there. So our relationship building with the Ottawa folks as well as the regional folks is a big task. As mentioned yesterday, there are 200 some odd people working in the regional office. And then you have an incredible bureaucracy in Ottawa around how things are run and organized. And it's a very complex system that not only do we need to understand it now about how we can work with it to improve how the health actions are delivered, but we need to understand it as we explore the opportunities under the governance work and what it would look like for us to interface with Health Canada as a partnership in a post-governance environment. The fourth area for us around making sure we can move this plan forward is creating an effective First Nations Health Society organization. And so there's a bit of work that has to be done there. And although the Health Society is here only on an interim basis, it's important that it is the right tool to do the job. And as we move into this year with the board of directors being in place since April 1 and the society operating since April 1, a lot of work has gone on internally to make sure we can better equip ourselves to support communities and to support the work at the government level with the federal and provincial partners. So that work has moved forward, again, in a very, very accelerated time frame because we know that we're 2.5 years into the plan now, or just over 2 years since it's been signed, and there's a lot of work in front of us, and we need to find a way to make sure that we really have make great strides and some good traction on some of the areas moving forward. So when we look at the complex relationships, we at the Health Council are talking about systems change at a high level, that we're needing to engage senior people within the federal and provincial systems to talk about not just the action items specifically in terms of a very specific program, but the area that's being addressed overall. So something like eHealth as an example, that the plan talks about a integrated telehealth network for BC First Nations people. Well, that's just the beginning of the discussion. We need to be able to interface with federal and provincial people at a senior level because any telehealth system that we put in place requires connectivity. We need connectivity to our communities, a very important activity that if we don't establish connectivity to the level that we need, then telehealth will be minimal in terms of what we can do. And the opportunities will be lost. The potential of telehealth to change perhaps or value add how health services are delivered in our communities is a great opportunity. In addition to that, we need to link into the decision makers in the federal and provincial systems, including the health authorities that are involved in establishing their e-health networks and mechanisms and machinery within those big systems, because our system has to talk to their system. So a lot of work has been done to start looking at a collaboration at a senior level where the provincial government has a strategy council for e-health, and that the First Nations Health Council has a seat on it, in which I occupy, and in support of that, creating an e-health strategy council, a First Nations e-health strategy council, where we sit with our tripartite partners at a senior level and make decisions that will help us align with the bigger plan and ensure that the bigger plan will accommodate what we need to do on the ground. And so a lot of work being developed in the machinery that needs to be created to support that dialogue. And I guess, in closing, I know there's a lot to be talked about, and a lot of discussion will happen today around the different activities in some of the health action areas. That, again, keeping in mind that implementing this health plan successfully is about managing a lot of complex relationships, and that the understandings that the party have are often not quite where we want everyone to be. It's not easy for the federal and provincial government to talk to one another and to actually understand what each other is saying. And I know, let alone all of us, 203 First Nations communities in BC. In my past life at the treaty table, I spent a lot of time with First Nations in the treaty process talking about what I thought was going to be a common issue, but we all looked at it differently. So it's a very complicated when it gets down to each of us and the things that we believe in and what are important to us. And so what I wanted to leave you with was a quote that I got from a book written by Rupert Ross. And it was a book actually given to me on my last trip to Ottawa and talking to people at Health Canada headquarters. And it was kind of enlightening to see that they were looking at things or reading this kind of material and trying to take from it what they could learn. And the book by Rupert Ross he's a judge in Ontario that was working with a lot of Native people in the court systems, and finding out that the differences between how a court system runs and operates and how our people are in terms of our culture and how we carry ourselves are inconsistent in terms of what the courts think we should be doing versus what we do. And I think that it's a very interesting quote, which he, in his book, he says he found written on a blackboard in a Northern Ontario First Nations community. And it really gets to the point of how difficult it is to make sure we're all on the same page. So the quote reads, "I believe you understand what you think I said, but I'm not sure you realize what you heard is not what I meant." And I think it's really important for us to remember that, because that conversation that we're having all the time, are we really hearing each other, and are we really getting, in terms of what we're trying to get to? And it's going to take a little bit longer for us to get there. And I think that what our job is to not only try and be clear in what we're saying, but it's also to listen and hear. Because with our federal and provincial partners, we've been very clear to them that even as they're briefing their senior people, that we've said to them, we need to brief them ourselves. Because I don't think you can tell them the same way we can tell them what's important to us. And as we build that conversation through the Health Council, and we build that conversation through the hubs and the caucuses, we expect that more First Nations people will have that direct opportunity for themselves. And our job is to build that space for you. So we continue with our efforts moving forward, and I look forward to hearing the outcomes of the discussions this afternoon. I think the dialogue with the health authorities is an extremely important piece of this in terms of moving the health actions forward. And again, thank you for your time today and listening to me. Thank you.